How can you treat bladder leaks without surgery? Hi everyone, I'm Dr. Nabila Noor, your gynecologist and a pelvic reconstructive surgeon. And believe it or not, depending on what kind of bladder leak you have, there are lots of non-surgical treatments that I discuss with my patients. And for many patients, surgery is really not required. So let's dive into it. Now, when we talk about urinary leakage, some women leak with laughing, coughing, sneezing, what we call stress urinary incontinence. And then there are other patients who have leakage because of urinary urgency, not being able to make it to the bathroom in time, a lot of nighttime urination. This is known as overactive bladder. And depending on what kind of urinary leakage you have, the non-surgical treatments may vary. For my patients with stress incontinence, things like pelvic floor exercises to strengthen their pelvic floor muscles can be a great starting point. There are also different kinds of vaginal inserts, such as a pessary that we put inside the vagina sometimes to help support the urethra that can help with these symptoms. For my patients who are suffering with overactive bladder, we start with things like keeping a bladder diary so we can actually identify what are some triggers that's causing their bladder to be overstimulated and spasm all the time. We look at their bladder habits and how often they're having leakage. Looking through that together, coming with a plan to train their bladder so that they can hold a little bit longer, that can be really helpful for these patients. There are also medications that we often do that can help the bladder muscle not spasm at all, and that can help improve their symptoms. So going back to the original question, is surgery necessary to treat your bladder problems? Not necessarily. Surgery is just one other tool in the toolbox, but it's definitely not the only one. Check out my YouTube channel and subscribe to it to learn in more details about what are some options that you can have